New recommendations for breast cancer screenings causing all kinds of controversy today, what they are, and why this survivor says you've got to rely on more than a mammogram. 10 TV News HD at 5 starts right now.
From Central Ohio's news leader, presented in high definition, this is 10 TV News HD.
Well, Kurt, controversy is bubbling tonight after a new report out from the U.S. Preventative Services Task Force. That task force is recommending women under 50 with no risk factors don't need yearly mammograms and are only recommending the breast screenings every 2 years for women 50 and older. They say early screening can lead to false positives and unnecessary biopsies. Now, their study also says that self-exams aren't doing much good either. Dr. Tom Busse is here this evening with us. He's from Riverside Radiology Associates. And you said this morning when you were in the office, you were hearing from patients confused about this new report.
They're very confused because this runs contrary to what they've been told for years and what most of the major medical societies are recommending, which is currently screening mammograms every year starting at age 40 and annual mammograms beyond 50. And now the new study, or this particular task force, is coming out with different recommendations. So a woman who's sitting at home and getting ready to start her screening program now doesn't know what to do. Our recommendations as radiologists haven't changed. Our society, the American College of Radiology, the American Cancer Society, those major organizations still continue, despite this report, to recommend annual screening beginning at age 40.
And we've got some numbers up on the screen. 1 in 69 women in their 40s will develop breast cancer. What other things? I mean, this is some information that you would...
Sure. 2/3 of all women between 40 and 49 are getting screening mammograms. And we've seen since 1990 about a 30% reduction in cancer or mortality from breast cancer. And a lot of that has to do with early screening, self-breast exams, seeing your physician. And we're afraid that we're going to take a step backwards from the major improvements that we've made with these new recommendations, because we are seeing cancer in women under 50, and if we don't screen them, our fear is that they turn 50 and now their cancer is a later stage cancer, it's a bigger cancer, and it requires a bigger surgery, or might be more life-threatening at that stage than if we had caught it when they were in their 40s.
So now, of the women who do get mammograms, how many do you find end up actually having cancer?
Okay, if we screen 1,000 women, about 100 of those will come back. So about 10% of women that we screen, we recall for additional views, and about 10% of those women that we call back, we're going to recommend a biopsy or some form of a surgical procedure to find the diagnosis. And then of those patients, about 25% will have cancer. And about 1 in 8 women in their lifetime will develop breast cancer. This is not a trivial, insignificant disease we're dealing with. This is a major killer of women.
All right, and finally, before we let you go, real quickly, your recommendations?
My recommendations is that women who are out there continue to do what they've been told. This is very new. It hasn't had a chance to be rebuked by most of the major medical societies. That's already beginning to happen, and I don't want women to feel reluctant to come in just because of this one task force recommendation.
All right, Dr. Tom Busse, thank you for joining us this evening.
Thank you for having me, Tracy.
Kurt?
Thanks.